Hello, welcome to Santa Fe College Nursing Simulated Lab. My name is Professor Sandra Milner, and today I'm going to be demonstrating a complete head-to-toe physical assessment. The video is going to be broken up into two parts. Part one is going to include assessment of the patient's head, their upper torso, their abdomen, and questions related to the genitourinary system. Part two is going to include the patient's lower extremities and their back. The head-to-toe physical assessment follows a systematic approach. You go from the head to toe, and then the back is assessed last. You adjust your assessment based off of the patient's developmental level and their cognitive level. There are a few things that you assess throughout. This includes skin and hair distribution, and then also the patient's speech, whether they have purposeful movements, and whether they're able to follow simple versus more complex commands. So if they're able to follow one-step versus two-step commands. If you ask the patient to turn over and reach for the rail, are they able to do those two commands? Vital signs are usually completed at certain times during the day. The only time you complete vital signs with an assessment is if your patient is having an acute change or problem with a specific system. Good morning, Miss Griego. How are you doing today?
Good.
Okay, my name is Sandra. I am your nurse today, and
Okay.
the first thing I'm going to do is complete a head-to-toe physical assessment. First, I'm going to wash my hands or sanitize. While I am cleaning my hands, I am going to do a general survey of the room so I can see that she has a suction canister, she has oxygen. We have an IV pole. I am checking the bed. The bed is locked. She is in the lowest position and two side rails are up. Okay, Miss Griego, we're gonna go ahead and raise your bed so I don't hurt my back. I am also gonna lower this rail. How are you doing today?
Good.
Can you tell me your first and last name?
Kasey Griego,
And I'm gonna check her armband. And what is your date of birth?
May 2nd.
Okay, perfect. And do you know where you are?
I'm at the hospital.
And do you know why you're here at the hospital?
I've been having some stomach pain.
Okay. And are you in any pain right now?
No.
Okay. And so on a scale of 0 to 10, with 10 being the worst pain and 0 being no pain, could you rate your level of pain?
I'd say it's a 0.
A 0? Okay, wonderful. And can you tell me what year it is or what month?
It is March
March? Okay. And what year?
2017.
Okay, perfect. Okay, so now I'm going to take a look at your face, and I do not see any facial drooping. Can you smile for me? Okay, perfect. So first thing we're going to do is take a look at your nose. You can just look up. And can you breathe through your nose? Perfect. Any problem breathing through either side?
No.
Wonderful. And can you open up your mouth for me? I'm going to shine my light. I'm looking at her teeth. And can you say ah? Perfect. And I see her uvula rise. Now what we're going to do is look at your ears. Do you wear glasses?
Yes.
Okay. And do you wear hearing aids?
No.
Okay. I'm going to take a look at her ears. Make sure you pay special attention to the top part of her ear where you might have oxygen tubing. And can you turn to the other side for me? Perfect. And I do not see any sores or lesions. If your patient is not able to turn their head, you want to, when you are on the other side of the bed, you want to do a better assessment of that side of the ear. I'm also going to take a look at your head. It's a normal shape. And do you have any pain on your head?
No.
No, where I was pushing. You have even hair distribution for a female patient. Can you turn that side for me? I'm going to take a look at the back of her head. And I do not see any hair loss or breakdown of the skin. You can also take a look at the back of her head a little better when she rolls over to the side. I'm also going to take a look at your neck, so if you can just look slightly that way. And I do not see any jugular venous distension. So now we're going to look in your eyes. And what I'm looking for is the change in pupil shape. So I want to see her pupils, both sides, constrict when I shine the light. And then we're going to look for accommodation. So we're looking for perla. Pupils are equal, round, and reactive to light and accommodation. So I'm going to shine the light first in the side. Just look straight ahead, please. and you need the room somewhat dimmed. And then what I want you to do is take a look at the top of the wall, and now look at my pen. Perfect. And when she does that, her pupil should constrict when she looks closer. So now we're going to go ahead and assess your arms. So I'm looking at skin. I see you have an IV here. Any pain or tenderness?
No.
Okay. And I see it is within date. So I'm going to look at her skin. I'm looking at bony prominences. I do not see any skin breakdown. You put that arm down. I'm going to look at this side. And if I cannot see very well, you do want to go to the other side of the bed. Okay, and no IV. I'm going to check your pulses, and you always check pulses bilaterally. And so those are 2+ and equal. I'm going to check cap refill, less than 2 seconds. And then can you bend your arms for me? And okay, and again. Good. And then can you squeeze my hands? Perfect. So she has normal strength and full range of motion. Next, what we're going to do is go ahead and listen to your heart and lungs. So we have the mannequin here to demonstrate the correct positioning for listening to heart sounds. What you want to do is you want to find the angle of Louis on your patient, which is the little notch. If you go to the left or to the right or the left side, you'll find the second intercostal space. On the right side of the patient, you'll best hear the aortic valve. That is in the second intercostal space, right sternal border. If you move over to the left sternal border, second intercostal space is where you'll hear the pulmonic valve best. If you go down one rib into the third intercostal space, this is where you'll hear the Erb's point. If you go down to the fourth or fifth, depending on your patient, intercostal space, left sternal border, that is where you're going to hear the tricuspid valve best. In the fifth intercostal space, mid-clavicular line, so that's the middle of the clavicle, right in that mid-clavicular line, fifth intercostal space is where you're going to hear the point of maximal impulse, which is your mitral valve. Normally you would listen under the patient's gown, but for the purpose of the video, we are listening over the patient's gown. Aortic, pulmonic, Erb's, tricuspid, and mitral. And then I'll switch. Okay, very good. Now I'm going to listen to your lung sounds. You want to listen through a whole inspiratory and expiratory cycle. And you always compare side to side. Can you take a deep breath in and out? I'm going to listen under your arm over here. And then under this arm. Okay, excellent. So now I'm going to go ahead and listen to her abdomen, and what you want to do is lower the sheets and lift the patient's gown up. And again, we're going to be listening over close for the purpose of the video, but you would always move the patient's clothes out of the way. So the first thing I would do is inspect the abdomen. And then I will listen and then palpate. You listen in each 4 quadrants. Okay. And you said you're not experiencing any pain right now, correct?
Correct.
Where was the pain before?
Kind of just all over.
All over? Okay. Let me know if anything hurts. I'm just doing light palpation. And when was your last bowel movement?
Yesterday.
Okay. I do not feel any obvious masses or hepatic distension. And any trouble peeing?
No.
Okay. Normal color, no burning, no pain?
Nope.
Okay. Any bowel movement changes?
No.
No color changes, not very hard or too soft?
No.
Okay, Wonderful. And that completes the end of part 1. So stick around for part 2 where we're going to be assessing the lower extremities and the patient's back.